Hi there, good afternoon. My name is Zhang. I'm here to represent the team at City of Hope. And what we have here is just a poster analyzing the microbial dysbiosis as a predictive factor for benefit with CBM588 in sort of combination with standard of care therapy options for metastatic renal cell carcinoma. So CBM588, for those of you who aren't aware, is a live bacterial product. So it is an oral capsule that patients are able to take that has been indicated to have increased benefit in anti-tumor immune therapies, specifically in the case of renal cell carcinoma. So what we did for this particular project was analyze 2 phase 1 clinical trials that evaluated these live bacterial products in combination with standard of care. So in particular, these 2 clinical trials had standard of care options for renal cell carcinoma as Nivo-Ipi and also Cabo-Nivo, with and without CBM588. And we essentially looked at baseline characteristics and also looked into the overall response outcomes for the patients who underwent these different regimens. And I would like to direct you to the summary of results. So the overall response rate for patients who received CBM588 in addition to standard of care, as you can see, significant improvements to standard of care to standard of care with the addition of CBM588 for overall response rates, as well as the disease control rate. So what we see is that this addition of CBM588 to the standard of care options significantly improved the disease control in these patients with renal cell carcinoma. Figure 1 looks at one of the primary endpoints of our study, which was progression-free survival. As you can see from these 2 curves right here, there was a significant improvement in progression-free survival for patients who underwent this additional live bacterial product compared to those who received standard of care alone. And for table 3, we actually have a safety and adverse event profile that really looks into the grade and the severity of different adverse events. And the key takeaway from this particular safety profile is that there were no new safety concerns that were particularly raised by this particular chart. In conclusion, this really shows that there is a significant sort of potential for CBM588 in this space to add it to various immune checkpoint inhibitor-based regimens for metastatic renal cell carcinoma. And we are excited to further explore these opportunities and options in the recently activated SWOG Biofriend study that is coming out.